Hi, everyone. I'm Dave Maginley. I'm with spiritual care at the Cancer Center. I'm a chaplain. The joke is that I'm the high priest. And my job is really to help people with the experience, help them navigate their fear and anxiety, and connect to the deepest inner strength and hope that they have. And faith can be part of that. But I see people of all faiths and no faiths and all backgrounds, and really just helping with the experience. So before I go into my talk, we're going to do a meditation. I'm going to guide you in a meditation. So I'd like you to sit comfortably with your legs uncrossed and your back fairly straight. This, I find, is actually not the most comfortable position. I usually like to slouch, but we're going to try and keep our back straight and keep your tummy fairly in. I mean, you don't need to really hold it in tight, but imagine there's a string going up from your top of your head, and it's pulling you up nice and balanced. So we want to feel the balance of your head upon your neck and feel your back supporting your body more than necessarily the chair supporting your body. But if you need to use the back of the chair, that's okay. You can close your eyes. And I'd like you to feel the floor beneath your feet. Feel the weight of your feet upon the floor. Feel your feet wrapped in shoes and socks. Feel your legs resting, your body weight supported by the chair. You're really listening to the experience of being here now. Listen and feel your breath going down. You can direct it to your stomach. Feel any tightness in your chest or your shoulders or neck, and don't try to change it. Just be aware of it. You can feel any tension in your forehead. Feel how your cheeks and your jaw are. You can be aware of your lips and even your tongue if it's resting on the bottom or the top of your mouth. You're directing your awareness now to your arms and your hands, your fingers. And we're doing this very lightly, not with a lot of energy and intention or focus, just lightly moving the awareness through the body. And now I'd like you to listen to the air conditioner for a few minutes. While you're listening, be aware of how your thoughts might be distracted, might be jumping around, and let your thoughts do that while you watch them and listen to the air conditioner. be aware of your body once again. Focus your awareness upon your mind, your chair, your feet, and open your eyes. There we go. So it's so fantastic to talk about the relaxation response and meditation and mindfulness and the importance of relaxation when you're going, especially through cancer treatment. But we have to practice it. How did you find that? Was that relaxing or difficult, straightforward, or what was it like? What did you notice? Yeah. Difficult at first, yes. Yeah. Yeah. What were those difficulties and challenges? What was interrupting you? Yeah, so a flurry of thoughts, right? You thought you were trying to still your thoughts down, but they kept jumping around, right? Yeah. A lot of people think that meditation is about calming the mind, calming the thoughts, being completely at peace. And it's actually not. You cannot stop the mind from thinking. That's what it's for. Meditation is observing what's happening in the moment, really showing up with it and being aware of what's happening. So if your mind is jumping around all the time, you actually don't want to stop it because you're trying to suppress what comes naturally to it. And by trying to suppress it, you're going to agitate it even more. So it's listening to the thoughts and being curious about it and using this practice to learn about yourself. An amusing irony is most of us spend most of our energy avoiding ourselves. Through the course of our day, our thoughts are jumping to what will be happening, thinking about what did happen. We may be a little hungry, we're aware of the body, our mind is constantly distracted. Very rarely are we truly here in this moment. And that's why mindfulness and relaxation and learning to work with fear and anxiety is so important when you're going through cancer, because you're fighting for more moments of life, but you're avoiding the moment that you're in. And the best way to be a partner in your treatment is to be fully present in the moment and use your mind to work with the body and the body to work with the mind, and the chemo to be a part of that. Notice if you're dealing with cancer right now, remember what it was like when you were diagnosed. You heard that news, right? That fight or flight system kicks in. You may have blanked out and not been able to comprehend what was being said. You may have started to sweat or feel dizzy or nauseous. You may have needed to go to the bathroom. All of those normal survival mechanisms in the body. And the most important thing you can have at that moment is a wingman, a friend or a partner to listen and help process so that they can tell you what just happened. I've spoken with so many patients who say, after my diagnosis, I was surprisingly calm, and I just walked out to the car and I sat in the car, and then I completely collapsed. Then I completely blanked out. A natural response. So, how to show up in the moment so that you are fully participating in your life and fully activating the integrative, the neurophysiological aspects of your healing. The best way is to accept that you will do it inconsistently. Allow yourself to have a sense of humor and be very inconsistent with this practice. I loved that comment you talked about. The neocortex became thicker in those who practice meditators. Fantastic studies using fMRIs on monks who had been meditating for 30 or 40 or 50 years. Their brains are actually structured differently than the average person's. Remarkably, in the study, they then took the most difficult subjects for teaching meditation to, college-age males, and they trained them for 6 weeks, and then did like they had done it before, and then they did an after fMRI of the brain structure. And guess what? After only 6 weeks, they began to see differences in the neocortex. So it's just like exercise. You don't need to believe it's going to work. Just pick up the weight and do it. But do it slowly, in moderation, and build in small incremental steps. Now, when I do say the word meditation, do you think of a person sitting in the lotus position with their legs crossed and their back straight, right? And they're like this? I can't cross these things at all. I am a newborn giraffe on the basketball court or in the lotus position, and it's just terribly uncomfortable. The key is with meditation, you start really small. Start with just 5 seconds of practice. Be aware of the moment. Now, I was thinking of this as I walked down to do this presentation. My wife had said to me this morning, you want to go to Saltscapes? Saltscapes is on. Let's go have family time because it's the weekend. Family time. Our daughter will love it. And I said, you do know I have the talk down at the Westin this morning. Yes, but after that, let's go to the Saltscapes. And I said, I have a haircut appointment at 1:30. And she said, really? It's the weekend. Can't you change it? Maybe they're open tomorrow. And so I'm getting out the phone. It's time to walk down here. I'm looking up the number. I'm thinking I'm going to be late. My fight or flight mechanism is kicking in. And me, the minister, the religious one who practices meditation, shut down his frontal lobe, and I could not process any information. I couldn't push the buttons on the phone because I didn't want to disappoint her, and I know that tone in her voice. When she really smiles and gets sweet, you're in trouble. So I said, I'll look up the number as I walk down, and I'll give you a call and let you know what I find out. So that's what I did. They're not open on Sunday. I put my phone away and I decided, I want my haircut. I'm going for my haircut. I'm just going to enjoy this. I'm going to focus on my talk on mindfulness. But I wasn't mindful. I was stressed and thinking about all of these factors, and I was not showing up in the moment. And so I practiced 5 seconds at a time. Notice that building. Notice my walk, the weight of my body and the steps. I'm dealing with my anxiety. But I could only hold it for a few seconds at a time. So I called the salon and I moved my appointment to Monday, and I texted her, and now I'm all right. Put the marriage first. Dealing with anxiety, tiny little minor inconsistent anxiety such as that, getting a haircut, changing an appointment, or massive anxiety. You're going for surgery, right? You're waiting for the pathology report. The same principles apply. Be with the fear. Don't abandon it or fix it. It's a natural survival instinct. Breathe into it, be present with it. Listen to the wisdom of your fear and your distress. What is it saying to you? It's talking about what is most important in your life, what you fear you're going to lose, that sense of not being in control and the unknown. So all of those are part of the reality. When you breathe into it and are fully present with it, it changes, because the little trick is the quality of your presence with yourself will determine the quality of your experience with life. So when you change the quality of your presence, you will be able to feel the fear without it controlling you. You have the emotion, it doesn't have you. And you will do this inconsistently. Nobody becomes a master. So let's talk a bit about the fear and anxiety. Do you remember, well, we talked about the physiological effects. Tightening in the gut, dizziness perhaps, not being able to process information. I recall this acutely because I had been dealing with a different type of tumor called a pheochromocytoma, which makes adrenaline. And so when your normal adrenal gland turns on, it was like a switch, and my tumor would release all this adrenaline into me. Talk about fight or flight. So to survive, I had to develop a mindfulness practice and allow myself to feel so dizzy that I might need to pass out, right? Or need to use the washroom, or not be able to process or speak. When you're getting that scared, simply attend to what needs to be done. I need to sit down. I need to lie down. I need a glass of water. I need to breathe. I need someone to hold my hand, to be present. A damp cloth on my forehead. I need to do some other steps that bring me back to myself. I'd like you to do one right now. As you're sitting listening to me, I want you to curl your toes. Curl your toes in your shoes. Now, this is a technique I use with wedding couples. I do a lot of marriages, and the bride and the groom are very anxious when they're up in front of everybody. They're about to do, I'd say, curl your toes in your shoes. It's easier for the groom than it is for the bride, because it's going to relax the spinal column. It's going to give you a focus of attention. Your awareness will go to that spot. It's also going to help circulation. Another thing you can do is crack your knuckles. So just try it right now. Let's see if we can hear everyone. We're simply creating a physical sensation that becomes the focus of awareness. Mindfulness is paying attention, even if it's only to one simple thing, and your body will be the best barometer or instrument to work with in order to bring down anxiety and fear. So curling your toes, cracking your knuckles, having a drink of water, feeling the moment instead of suppressing it will actually change your experience and lower that fight or flight response. Now, this is actually a spiritual principle. I don't know what spirituality means to you. It's different for everybody. But it encompasses so much more than religious definitions. It's about your connection to yourself and to your life and to the awareness of something much greater than you. And when you're diagnosed with cancer, you're going for surgery, all of that is at stake. It's all on the table. And you're wondering, how is this going to turn out? That fear can be the greatest tool in bringing you back to your life in a greater way. Notice how cancer threatens to take your life away, but it also amplifies the gift of your life at the same time. So we want to use fear to continue to amplify the gift. I want to read you a poem. This is by Derek Walcott, and it's beautifully expressing how all through our life we're trying to find a way to fully embrace and connect with the gift of who we are, but we're always looking for that gift and that answer outside of ourselves. Cancer can be a tool in bringing you back to the greatest gift you could ever experience, which is your uniqueness and your experience. This is what he writes. The time will come when with elation you will greet yourself arriving at your own door or in your own mirror, and each will say to the other, sit here, eat. You will love again the stranger who is yourself. Give wine and give bread. Give back your heart to itself to the stranger who has loved you all your life, whom you ignored for another, but who knows you by heart. Take down the love letters from the bookshelf, the photographs and the desperate notes. Peel your image from the mirror. Sit and feast on your life. After your diagnosis, as you thought about, I have cancer, I have cancer, I have cancer, did you find moments that were saturated with a beauty and an intensity that you really couldn't express it? Perhaps you sat down and you had a meal and you really tasted it. Or you held the hand of someone you care about and you really felt it. And the words choked in your throat. And the intensity, the beauty, the excruciating, fragile nature of your life was brought into your consciousness. That awareness is enlightenment. And it's excruciating. Being spiritually balanced and aware is not all it's cut up to be, because real awareness comes with passion and fragility, but within that vulnerability there is a deep strength. If you haven't already gone for surgery, you go down to that waiting area, you walk over, and they insist that you lie on a table or a gurney, and they wheel you down. Sometimes you can walk down to the operating room, and you get in there, and it's so cold. And that green color on the walls, I don't know how you keep your spirits up in there. That's why you play the music. And you lie down there. It's cold because that helps surgeons keep, awake and alert over hours, and it helps with the instruments. But you're lying there, and you're shivering, and you're shaking because adrenaline is coursing through your body, and you're scared, and you're wondering. And then the anesthetist says, I'm just going to give you a small thing here to help you relax, but it's much bigger than a small thing. And you really relax, and they count back from 10, and you don't even get to 7, and you're gone. And you're so grateful finally to be asleep. And then when you wake up, that disorientation, the heaviness, that strange taste and smell, the sounds that are like fog in the distance, the weight of your body, and the wondering, what just happened? And then you remember. This awareness, this fear, has been wired into you over thousands and millions of years, and is part of your wisdom to work with compassionately and gently. After the surgery, let's say you get the clear. You're good to go. The margins were clear. Everything looks good. And you walk out of the cancer clinic and you feel like you should be happy, but you go home and you don't feel safe. You wonder, will the cancer come back? That also will be one of the greatest teachers, keeping the gift of life on the tips of your fingers and keeping the awareness and the engagement with how beautiful it is in your heart. Now, Rob talked about how it changes your brain. I want to conclude by talking briefly about how it changes your consciousness. I want to watch my time here. When you are compassionate, when you are feeling loving and even humorous, the actual frequency of your consciousness is changing. Fantastic anesthetist and professor, and his name is Stuart Hameroff, and he works with a quantum physicist named Roger Penrose, who's a friend of Stephen Hawking. So these two were developing a theory of consciousness, and what they discovered was quantum information seems to be mediated through the nervous system of the body. And it collapses, they call it quantum gravitic collapse. It collapses into a Newtonian energy and a release of a photon, a particle of light, from your nervous system every 50 nanoseconds. And this is a moment of now, and a stream of them is a stream of consciousness. And when you meditate, when you love, when you laugh, you actually modulate the frequency of your consciousness. And it creates a cascade effect. The photons which are released change their specific resonance and amplitude, which creates a cascade effect within all the neurological and biological processes of the body. So when we talk about the mind and body connection, now we're talking about the spirit-mind-body connection, although we're using a quantum language for it. It's fantastic, it's mind-blowing, and it just isn't that important. Because the critical thing is that you work with your anxiety, you honor your fear, you learn how to breathe into it, and you find that you're loving more intensely and living more deeply because of it. So, if you're in those positions, if you're going for surgery or you're in the middle of your cancer treatment and you want to explore this, you can give me a call. You can also talk to Dr. Rutledge, and there are many others in psychosocial support who can help you with this. We don't go into the quantum physics aspect of it. We help you just deal with the anxiety and the distress in the moment. So, to wrap up, let's just take a moment. There's food out there. We can hear it. And it's triggering some other responses. Feel once again your feet on the ground, your body in the chair, and we're going to briefly, for just a minute, do a mindfulness exercise called Tonglen. Going to close your eyes. I'd like you to think of anything that distresses you, or it could be a memory, or you could just think about cancer. And I'd like you to breathe in that same distress from the other people in the room and breathe back to them your compassion. And that can be done through the words, I understand. Just silently saying, I understand. Breathe in what is distressing. Breathe out, I understand. This is a wonderful thing to do in the waiting room of the cancer clinic. I understand. Okay. Thank you very, very much.
Do we have some questions around that? Maybe while you're thinking of that, Dave, one of the issues that I think about is that we humans don't like the experience of being fearful or being anxious and so on, and so it's quite natural for us to want to push down and kind of get away from those feelings. One of the things that we do during the weekend retreats is actually to look into, like, literally try to figure out what it is that scares us the most. And so oftentimes we talk about death and dying and our greatest fears, and as people begin to explore that, the kind of scare of the unknown becomes much less in some sense. So someone could say, I'm scared of dying. What is it that you're scared of dying about? I'm scared of losing my loved ones, leaving my wife behind, or that would just be terrible, and people can cry around that issue and so on. But as they begin to explore it, it kind of lessens the fear in the circumstance, and they can actually have a conversation with their wife or loved one, and it actually lessens the scenario. So you want to have some reflections around this idea of actually going into your fear and really exploring it hard, as opposed to running away. So.
Yeah, I had a case earlier in which a fellow had failed 2 types of chemo, and he was likely going to die. He was going to die, but we did have an experimental chemo to offer him. He talked with me about, when I sat with him, I said, are you going to die from this? And just saying those words to him took the weight off his shoulders, and we had named what he had been holding so tightly inside. And it was such a relief. Turned out, of course, he wasn't afraid of dying. He was afraid of leaving his loved ones. The greatest fear is leaving those you love, because grief is the price you pay for love. And I asked, are your family afraid? Do they talk about dying with you? And he, absolutely not, but he knows that they're scared. So when I went to talk with them, to sit with them and say, what do you think is going to happen? And they said, we think he's going to die. I think you're right. And he knows that. And it would be lovely for you to be able to talk about it openly. By naming those fears and being lovingly, compassionately present with them, it transformed the whole feeling in the room. When I went in the next time, they were in there, he was smiling, they were laughing and sharing stories, and they were really connected because they were able to be authentic. Now, this doesn't need to be death. It can be, I wonder if I'm ever going to have kids. I wonder what the surgery will feel like. I wonder what my future will hold. Talking about those fears processes them so they're no longer stuck, but the wisdom has been activated.
And just before that next question is, the other thing that comes to mind is the idea that it's like a process. We can't just, snap and have the fears run away. It's kind of like grieving. It has its own kind of lifespan, and if you actually go into it and feel it and so on, it will change. And it can take some time to actually make those transformations, but we humans want to feel better instantly, and that's just not natural as well. I mean,
that's what medication's for. We have a question?
So just going back to what you were saying about talking to the person about death, I know when my son was ill, that was one topic I couldn't even bring myself to discuss. I thought about it a lot and thought about talking to him if something happened, what would your wishes be? But as a parent, how do you even approach that with your child when they're ill, and especially with cancer? Like, how do you even bring that topic up? How can your head even go there? Because I know mine, it was there, but I verbally could not speak it, because if I spoke it, it might come true.
It's got to be the hardest thing in the world when it's your kid. One of the best things is to have someone else there to help you both talk about it. It could be, but when you're sitting in your house, or you're sitting in the hospital room, sometimes it comes out just through the tears and the bursting heartache that says, "I'm so scared," and you protect, right? Yeah. Yeah. And it's the protective instinct. So come out of the room, talk with a nurse, or seek out someone else to talk with so that that feeling isn't stuck. It can be processed. That shifts how you're present with yourself slightly, and then you can go back in and sit with each other. You both know that it could happen. Death could be there. And most of the time, it's the nonverbal communication that is able to carry the weight of love and meaning. But you're holding yourself together, so much energy just to stay calm because you don't want to scare him, and he's doing the same because he doesn't want to scare you. Yeah. Yeah.
so I know we're coming to the end of time here, but I do want to share that story because it is the hardest thing in the world. I was sitting with a woman near the end of her life. She said to me, "Don't tell my husband I've got cancer." And I'm, have to respect her vulnerability and so on. I'm walking down the hallway. I get pulled into the side closet by the husband. The husband says, "Don't tell my wife that she's got cancer." Right? So the fact is they kind of already know that there's a problem, and there's this kind of underlying assumption, if I break down and show my vulnerability in tears, that will make that person feel worse. That's the kind of assumption, but it's kind of irrational. And I think what I've been trying to encourage people is just to be totally authentic. And I know it's the hardest thing in the world, and I know you're thinking, if I'm breaking down, it's going to make my son feel worse, but actually there'll be incredible bonding, and then there's some real sharing, that the conversation can happen at that point in time. So, yeah.
Death is the most significant thing to happen in our life, besides our birth. To be able to die heart connected to others, aware and filled with compassion, and the tears, because the tears are expressions of the love, can actually bring beauty and depth of humanity to the most frightening experience imaginable. It's so strange to say I've been privileged to witness some beautiful, amazing deaths that have just humbled me with the power of the love in that room. And it's the hardest thing in the world.
The great thing about testis cancer is that not to minimize any death, but the great thing, just for all you guys sitting here thinking, "Oh my goodness, what are we talking about?" The great thing about testis cancer is this is a very, very rare instance, thank goodness. But obviously people like Nick are doing research to try to obviously maximize any outcomes at all that we can in oncology. And really what a lot of this discussion is for everybody living, not just those with cancer. I think Nick and I might get more out of this talk than you guys as testes cancer patients, is however long we're here on this earth, how do we have the best possible life? And hopefully for all of you with testes cancer, it's a long, long, long life.
Yeah, thank you. Yeah.